Okay, so this next video, we're going to be talking about arteries, just arteries themselves. Now, we said before that it's elastic arteries are largest, then muscular arteries, and then arterioles are our smallest arteries. So we're going to talk about each one of these individually. So, with elastic arteries, these are the largest in diameter, which means they have the largest lumen. Okay. So the inside is the largest, and I'm sorry, I guess my office is really dusty right now because it's making my allergies act up. But so just bear with me. But they are the largest in diameter, these elastic arteries. So they have the largest lumen. They are the most elastic, that's why we call them elastic arteries. And they're also considered, they're called conducting arteries. Now, why they are the most elastic and why they're called conducting arteries is because these are the ones that are closest to the heart. So they are the ones that are feeling the full force of the contractions of the heart. So these arteries really don't have to use a whole lot of smooth muscle because the contraction from the heart allows them to expand, which is why they need to be so elastic. So the full force from the heart comes straight to those elastic arteries. So your aorta is an elastic artery. So again, it doesn't really need to use a smooth muscle because that force, that pressure from the heart contraction is going to go straight to those arteries first. So they have lots of elastic tissue so that they can expand from that pressure, from the contractions of the heart, and then go back to their original shape. Obviously, it's not this big, but you know what I mean. They're going to expand and then recoil. Recoil is the word to go back to its original position. And so conducting arteries, meaning they're taking the pressure and the force from the heart, and they're conducting that down the other vessels. Okay, so they're called conducting arteries. They do not contract much, like I mentioned. They don't need to contract much because they are so close to the heart, and they go off and they work off of that pressure from the force of the heart contractions. So they themselves don't contract much. They are essentially just elastic tubes that are going to hold on to the pressure from the heart and use that to propel the blood forward. So they are considered pressure reservoirs. A reservoir is just like a storage place for things, like a water reservoir. But a pressure reservoir means that they are preserving or storing that pressure. So let's say the heart contracts, these muscular arteries expand from the pressure of the heart. So they're holding on to that pressure from the heart. And when they recoil or go back to their original position, that's going to shoot the blood forward. Okay. So they expand and recoil as the heart pushes out the blood. So when there is atherosclerosis, so when you have atherosclerosis, okay, atherosclerosis, when you have plaque buildup in the arteries that causes the arteries to harden. Okay, when that happens and you experience atherosclerosis, those vessels are not going to expand as much. So they're going to really feel that pressure from the heart. They may experience some damage because they're not expanding. Okay, they're feeling that full force without having that kind of relief with the expansion. And so not only are they not expanding, so that they recoil and push the blood forward, okay? They not, I didn't mean to say not only, but they're not experiencing that expansion and that recoil, so the blood is not being pushed forward like it should. And if the blood is not moving along as it should, that means that the heart is going to have to compensate by contracting and pumping out that blood even more forcefully to get that blood keeping on moving. Okay, so atherosclerosis is just like with a garden hose. If you don't have that expansion, okay, what's going to happen? So like with a garden hose, okay, uh, if let me see, how do I want to explain this? So, like what I was saying with atherosclerosis and a garden hose. So, normally, because your elastic arteries are so elastic and they can expand so well and recoil, that you don't really get any kind of disruption with blood flow when the heart contracts and then when it relaxes. So when the heart contracts, it forcefully pushes blood out. Those vessels expand, blood is still flowing, and then even as the heart is relaxed, those vessels are recoiling so that blood keeps moving. So it's a continuous flow. Okay. Obviously, heart's or blood is going to be flowing when the heart contracts. That vessel expands, and when the heart relaxes, the vessel is recoiling or going back. And as it's doing that, it's keeping that blood flow continuous. The blood flow never stops. When you have atherosclerosis and your vessels have become hardened due to the plaque buildup, it's going to act more like a garden hose. A garden hose is much less elastic. It's much more rigid. You'll notice that with the garden hose, when you turn on the water, yes, you get the full blast of the water coming out of that faucet. However, as soon as you turn off that faucet, you're going to get just a trickle of water out until it completely shuts off. And so the heart isn't like that. We don't want it to be like that. You don't want to have your blood flow going full blast and then a trickle, and then full blast and a trickle. You're going to feel that in your body. Okay. The reason why we don't feel that blood flow going through our body as the heart pumps each time is because we do have that continuous flow. We have that expansion and recoil that keeps blood flow really smooth. But if you have atherosclerosis, your vessels are more rigid. You're going to get that kind of on and off sort of flow. It's not going to be very continuous. So hopefully that makes sense. Okay. Sometimes I need to like pause, think, and then explain it, or else I'll get all jumbled up in my words. So hopefully that made sense. Okay. The next type of vessel that we're going to talk about is the muscular artery. Oh, I guess before that, we're going to talk about atherosclerosis. Not yet. But we already brought this up. So like I said, atherosclerosis is the hardening of those arteries. So here we have a normal artery here. Here's an artery partially blocked by plaque. And when that happens, the vessel becomes hardened. It's not going to be as elastic anymore. And so you have that disruption of that continuous flow. Now, another clinical aspect to these muscular arteries, or elastic arteries, I'm sorry, are aneurysms. So with aneurysms, and actually before we get there, I mentioned before, if you don't have that continuous flow, okay, what's going to happen, especially because you're getting that full force from the heart, then it slows down when it relaxes because you don't have that recoil. Then you're not going to be getting blood out continuously as you should. So what's going to happen is that, and overall, because your vessels are hardened and more rigid, and there's less space also, you have a lesser diameter here, you're going to have a higher pressure in that vessel. And so if you have higher pressure in that vessel, it's going to be harder for blood to flow through it, and the heart is going to have to work harder to compensate for that. So we can write those notes down here. So hardened arteries require higher blood pressure to push blood through. So ultimately, your heart is going to be working harder to make up for the loss of elasticity in those vessels. Okay, so now with an aneurysm. What happens with an aneurysm? So here's a normal vessel here. And then here is an aneurysm. So what happens with an aneurysm is that you have a weakened artery that causes ballooning. So this artery, for some reason, has become weakened. And so when these vessels expanded from the pumping of the heart, this is your abdominal aorta, okay, coming straight off of the heart over here, because it's become weakened, okay, it no longer has that ability to recoil. So at some point, it forms an aneurysm where it kind of balloons out. due to that pressure and no longer has that ability to recoil the same way that it did before. So this is when a weakened artery causes ballooning of that artery. Okay. The abdominal aorta is the most common part of the aorta to experience an aneurysm. The most common portion of aorta to experience, or we can say to have an aneurysm. It's the most common portion of the aorta to have an aneurysm. Symptoms of an abdominal aneurysm, and you should call it an abdominal aortic aneurysm. I'll write that up here. This is an abdominal aortic aneurysm. So the common symptoms. So symptoms, if any, because they tend to grow slowly. So many of these aneurysms won't require surgery just because they are pretty slow growing. So that's something that doctors may want to just monitor. However, you can do surgery. They can open up the abdomen and try to fix that vessel with a graft, or there are some other smaller surgeries that they can do to help fix the aneurysm. But it all depends on where the aneurysm is. You can have the abdominal aortic aneurysm, and you can have surgery to repair that. But sometimes there are cerebral or brain aneurysms, and those are a lot more delicate. Now, you can do surgery, clip an aneurysm and such like that, if you've seen on Grey's Anatomy. But that's obviously a lot more delicate surgery, comes with a lot more risk and a lot more possible complications. So in many cases, because aneurysms do tend to grow slowly, that may be something that your doctor may just want to monitor over time. But the symptoms, if you do have any, for an abdominal aortic aneurysm, is going to be abdominal pain, which makes sense because it is in your abdomen. So abdominal pain. That abdominal pain may radiate to the back, so you may also get some back pain as well. You may have a pulsating mass near the belly button where that aneurysm is. And why it's a pulsating mass and not near the aneurysm, but near the belly button. Why it's going to be a pulsating mass is because that is part of your aorta. That is an elastic artery that feels the full force of the contraction from the heart. And so that pulsating that you're feeling is the contraction of the heart as the blood is pumping through that artery with each contraction. So that's the pulsating mass. And what they're going to listen for when they do oscillation, when they listen for abdomen sounds with their stethoscope, is they're going to listen for something called a bruit. This is a turbulent blood flow sound. Now, why they listen for the bruit? Now, if you have just a normal artery, normal blood flow, like I said before, it's continuous, so blood flow is continuous, so you should not be able to hear that. Now, if you have an aneurysm, though, the blood flow is not going to be continuous. It's not going to go straight down. It's going to come down and then have all this room to move around. And so the blood is going to go all over before it finds its way down these common iliac arteries. And so that's what they're listening for, is that bruit from the turbulent blood flow, from the blood all of a sudden having a lot of room to move around. And you can hear that with the stethoscope. Abdominal aortic aneurysms, these are caused by high blood pressure. So I'll say hypertension, caused by atherosclerosis that we talked about before. When you have atherosclerosis and the arteries have become hardened, they lose that elasticity and they're more likely to balloon out due to that loss of elasticity. Vessel disease could be like a type of inflammatory disease, which causes buildup, like with the intimate damage we talked about. Trauma, or it could actually be due to an infection that caused those vessels to become weak. So that is a abdominal aortic aneurysm. All right. Now we'll go back to the different vessel walls or different vessel types and their makeup of their walls. So next is a muscular artery. With muscular arteries, their main tissue is going to be that smooth muscle, and they are going to have to contract. With muscular arteries, go back. With muscular arteries, these ones are a little bit farther away from the heart, so they're not feeling that full force of the contraction from the heart. So in order to continue to keep blood moving, they have to be able to contract in order to push that blood forward. So muscular arteries, their job is to deliver blood to specific organs. They are also known as distributing arteries. Don't ask me why they give two names to all of these arteries, but they're called distributing arteries because they are the ones delivering the blood to all these specific arteries. These are most of the arteries in lab. Most of the arteries that you're responsible to know are muscular or distributing arteries. It's going to be like the splenic artery that gives blood to the spleen, or your superior mesenteric artery that gives blood to your mostly your small intestine and a little bit of your large intestine, or the with your renal arteries that give blood to your kidneys, and so on and so forth. So most of your arteries in lab are these muscular or distributing arteries. They are more smooth muscle, less elastic tissue. And so what that means as far as their function goes is you're going to have more vasoconstriction happening in order to move that blood forward, but it's not going to have as much give. It's not going to be able to expand and recoil as much as our elastic arteries. Okay, and I think that's all I wanted to say about that vessel type. Next is the arterioles. These are our our smallest of vessels, or not smallest of vessels, but smallest of arteries. And so our smallest artery, which is the arteriole, larger arterioles still have all three tunics, have all three of those layers, the tunica intima, the tunica media, and the tunica externa. Smaller arterioles, though, they kind of transition down and end up having only a single layer. A single layer of smooth muscle with the endothelium. So they end up getting thinner and thinner. The reason for that is capillaries is where gas exchange occurs, and capillary is just endothelium, and that is it. Just that thin layer of simple squamous epithelium so that you can have efficient and rapid gas exchange. With the arterioles, they are transitioning and making their way to become capillaries. So we can't just go from this large, thick artery to a single layered capillary. So we kind of have to have a transition down. Larger arterioles, which are still small, will have all three tunics, then go down to a single layer of smooth muscle with endothelium, and then down to capillaries, which are just the endothelium. These are called resistance vessels. So when you have a decrease in diameter, and you're going to learn more about diameter and resistance when you get to your PLA. But when you have a smaller diameter or a smaller lumen, you're going to have a higher resistance to blood flow, meaning it's harder for blood to flow through skinnier vessels. Okay, you can think of it as if you're drinking a smoothie or a milkshake, it is much easier to drink that milkshake from a thick straw than it is from a tiny, skinny straw. Okay, there's a higher resistance to flow when the diameter is smaller. Okay, so these smaller vessels have a smaller diameter and therefore a higher resistance to blood flow. We could actually make those diameters even smaller in order to make it even harder for blood flow to happen so that we can bypass delivery of oxygen to tissues when they don't need it. So again, we can change the diameter to change the resistance in order for us to bypass different parts of the body. So like, for example, when we are in our fight or flight response, we are not going to be doing much of urinary function, making urine, or much of our digestive function in breaking down and absorbing food, because our focus during fight or flight is to fight or flight, to get out of a sticky situation, or if we're working out, it's to get to the end of that workout. And so this allows blood flow to bypass tissues when necessary. And they work off of both neural from the brain, fight or flight response, hormonal, like with norepinephrine and epinephrine, they can act as hormones, and then chemical. So it works off of neural, hormonal, and chemical cues in order to decrease or increase that distance and resistance. And so, like I said, during your fight or flight response, you're going to probably slow down blood flow. You are going to slow down blood flow to your kidneys, to your digestive organs as you focus on this fight or flight response. And so the arterioles that are leading to the kidneys, that are leading to the digestive organs, are then going to vasoconstrict so the diameters are smaller, and so less blood flow goes to those areas because they need to go to other areas like your heart, your skeletal muscle, your brain during that fight or flight response. One really cool aspect, or one really cool application to that, is that we inject epinephrine to decrease bleeding during facial surgery. So we can kind of mimic that fight or flight response in the face, allow those vessels to constrict and increase resistance to blood flow, so you don't have much blood flow going to the face, so you don't have a whole lot of bleeding during that facial surgery, which is pretty cool. Okay, I think that's it. I'll go ahead and erase all of this before I look at what the next slide is. Yeah, so this is just a summary of elastic arteries are first, the closest to the heart. They have that expansion and recoil. Muscular arteries are the ones that are going to distribute. So they're mainly going to use their smooth muscle to contract to deliver that oxygen and blood to the organs that they're supposed to. And then arterioles are resistance vessels that can change the diameter in order to allow or bypass blood flow to different areas of the body. And then we'll come up to capillaries next. Yes, capillaries is going to be the next video. So I will stop it here, and the next video will be on capillaries.